just rewind. Put your mind on pause, cause it's sleep time. Go ahead, relax and unwind. Get everything you need to feel your night. You might just be a little cranky, but we got what you need to wake you up. And if you will, we'll teach you all you need to know about sleep.
Paying attention to sleep hygiene is one of the most straightforward ways of getting a good night's sleep. We're here with Dr. Bijwadia from SleepMedRx to talk about sleep hygiene. Thank you for joining us.
You're welcome, Lisa.
Let's talk about sleep hygiene. I think lots of times people don't necessarily understand that there are certain steps and things you should consider as you're getting yourself ready for bed each night. Can you tell us a little bit about that?
Sure. Sleep hygiene is really code for sleep habits and the environment that you sleep in. And it's the way that you make sleep conducive for you for the night. Remember, sleep is something that's a very natural habit that occurs every night, but it can go into disarray, and it can get into situations where you can't fall asleep well or you can't stay asleep through the night. And oftentimes that's because of poor habits or poor environment. And so we try to understand these correctable factors when we're talking to a patient, and that in general is what we call sleep hygiene.
So what are some examples of good sleep hygiene?
Well, one of the most common examples I think most people have heard of is the fact that you shouldn't be using electronic devices like phones and laptops at night, right? Because light, when it hits your eye, causes you to be more alert. It releases certain hormones that are alerting to your brain. So it gets harder to fall asleep after that. That would be a simple example. Another example might be people who have difficulty falling asleep might wake up in the middle of the night and look at their clock. And when they look at their clock and they're already having difficulty sleeping, they're going to get anxious, and that's going to make it harder for them to fall back to sleep. So those would be just a couple of simple examples of how you could change. By simply taking the clock out of your bedroom, for example, you could reduce the anxiety associated with your sleep patterns and improve your sleep.
So TVs, not a good thing in the bedroom?
No, I think that what happens is that when you expose yourself to TV or laptops or phones at night, the blue light, which is the light that your eyes are most sensitive to, starts increasing the alerting signals into your brain. And so now the patient starts having wakeful signals instead of signals to be lulling them to sleep. It's the exact opposite of what you want when you're trying to fall asleep. So certainly keeping those electronics away, at least for an hour or so before bedtime, is probably the best idea.
So besides electronics and light sort of producing technology, what other things that might be helpful?
Sure. I think one of the things that I would encourage people to do is to have a winding down routine. So if you know you're going to go to bed at, let's say, 10 o'clock, then an hour and a half before that, start doing some relaxing routines. Don't expose yourself to bright light, whether it's in the room or on TV. Rather, listen to some quiet music or read. That would probably be a more relaxing form of activity. Have a warm shower before you go to bed. Keep the room temperature cool. Make sure that their lights are dim and that there's your bed is soft and comfortable. Make sure that your pillows are well adjusted so that you're not in an awkward position when you're falling asleep. And then try not to think too much and worry too much about the day that's happened or the day ahead, because all you have to do is sleep for those 8 hours, and the next day is going to come no matter what.
Right.
So if you need to worry, journal it in a little book and fall asleep not worrying about the next day. So I think having techniques to try and relax yourself at night and get ready for the normal life's rhythm that takes over when you sleep for 8 hours is probably one of the parts of sleep hygiene that I really emphasize to my patients.
Do you have any anecdotal stories of a patient that maybe was a little bit hesitant? Like I think about, I have a TV in my room, and I probably get on social media just before I go to bed. Probably not good ideas. But have you ever had a patient that was maybe a little bit reluctant to try some of these things and did and had positive results?
Absolutely. I think that oftentimes patients, when you tell them that, don't look at your computer or don't check your email before night, it actually provokes anxiety initially. And it takes a little bit of time before somebody recognizes that it is something that you grow into. Once you take the phone away, all of a sudden you'll realize, after a few days that, I am feeling more relaxed. I am feeling like I don't need to play over the day multiple times before I fall asleep. And gradually, you will sink into that natural relaxation that needs to occur before you fall asleep.
Good information, Dr. Bijwadia.
Thank you so much.
Thank you. I definitely encourage people to give it a shot and see if they can get some more Z's each night. So,
Absolutely.
Thank you.
You're welcome.
All you need to know about sleep.
For more information on sleep therapy and similar topics, visit us at cpapsupplyusa.com or on our YouTube channel, CPAP Supply USA.